But now we shall talk about conventional treatment in Sweden. And the reasons why we have to treat children, I think it's important to remember. It is good to treat children because if we can treat them effectively, the risks to get cardiovascular disease later in life will almost disappear. That has not been shown in adults. We know that we can reduce cardiovascular disease with effective treatment. But for children, if you look at them and they are normal weight as adults, they have a normal cardiovascular risk. So there are many reasons why we really should treat them early. So how can we treat them? We can have more physical activity. We can reduce energy intake. And there are many advice we use there. Regular meals, no sweetened soft drinks, reduce energy density and things like that. And then we also have some delivery packages. And I think it's important that you really look at these things in different ways. One thing is the advice, what you really have to do. Another thing is how you deliver it. And there you can have help from family therapy, motivational interviews, and group sessions, and many other things. But that's only a device. So you can't say that you treat patients with family therapy, because that's something else. Family therapy is something you use for many different things. But here you use it for delivery of this package. You have to eat less. You have to accept to be less full, and etc. So what about the results in Sweden? We have no 5-year data, but we have at least 3-year data on continuous treatment. And if we look at those who have been treated in Stockholm for continuously 3 years, we can see that if you are young at start with, between 6 and 9 when you start, we have a continuous weight loss during 3 years. But if you look at those who are older, you have a very poor effect. You have initially an effect during the first year if you are 14 to 16 years to start with. But after that, you have no effect at all. So it's obvious that age is very important. If you start early, the effect is much better. You can plot it like this and look at the chance that you have a successful weight loss defined as that you have a decrease of 0.5 standard deviation scores of BMI or 1. And as you can see, if you start early enough, when you're around 6 or 7 years, you are around 70 to 85% chance that you can reduce or get to that goal. But there is a very rapid decrease in the success rate. Much before puberty, it's below 50%. And if you look at those who are 16 to start with, their success rate is below 10%. So the results are extremely poor in that group. You can also look at it in another way and compare those who are severely obese with those who are moderately obese. And here, 0 here is that you have no effect at all on the standard deviation score. And we can see that in those who are moderately obese, when they are young, we have a good effect. And the effect is decreasing when they become older. So there is a significant effect, but it's still not that good in 14 to 16 years old. But if you look at those who are older, who are heavier, those with a severe obesity, we can see if something, when they are young, they have a better effect than the moderately obese in the same age group. But look at those who are between 14 and 16 years old. There is no effect whatsoever. No effect whatsoever. And this is, I think, very important to realize. It's tough to see this, but we really need to find new ways to treat severely obese adolescents. And I guess that's exactly what you said too, Billy, that you see in... And as far as I know, there are no scientific studies showing long-term good effects with conventional treatment in adolescents. Despite that, we claim that this is what we shall do, because for the majority of children, we don't have anything better. But it is a little bit tough. It's also important to remember that if you are severely obese as an adolescent, you have, in most cases, been an obese 6-year-old as well. So if they had been identified and treated early, that we had at least have a chance to reduce their overweight more successfully than when we start to treat them when they are 14 to 16 years old. So which factors are of importance for the success rate? Age is the one that is absolutely most important. Degree of obesity is a complex factor, as you saw, but it is of importance. Eating disorders, we know, can reduce the effect of treatment. Neuropsychiatric disorders, usually they reduce the effect, but if you have a autism spectrum disorder, it's sometimes easier to treat them, because if you really can shift their eating habits, they stick to them and they lose weight. But the things that are not effective, surprisingly, was parental obesity. Someone mentioned a mother with obesity, but surprisingly, we could not see that the parental obesity affected the outcome. So if they had lean, overweight, or obese parent, it doesn't matter. Obesity genes, we haven't looked at that, but others have seen that those genes that are associated with the development of obesity are not of that importance for the success rate. Socioeconomic score, as we have discussed before, is very important for obesity development, but it did not affect the results in this study. So it is strange that the factors of importance for obesity development are of minor importance for the treatment results. And I think this is important, that we don't translate what we think is causing obesity and just reflexively think that it is of importance also for treatment, because it's not the same thing. So what does it look in Sweden? At what age do children come to obesity treatment? We have a quality registry for patients. I think we now have around 11,000 children in that registry. And we can see that patients came to obesity treatment a little bit later, earlier than they do today. Now it's around 10 years of age in mean in Sweden when they come to obesity treatment for the first time in their life. But that is far too late, because if the figures I showed you before are correct, we, when they come, have 40% chance that we can successfully treat them. But if they had come when they were 6 years, we should have 88% chance to help them. So we really need to see them much earlier. But if we go back to the topic and that we will discuss more this afternoon, we have no treatment with acceptable efficacy to offer severely obese adolescents today. And I think that is a very sad take-home message, but I think this is what we have to realize. Thank you.